everyone, welcome. We are the European project Diheco. Our goal is to generate knowledge on digital platform in the specific industry of healthcare. You're going to watch a series of videos about French initiatives that aim to leverage the creation of those digital platforms in the specific industry of healthcare. Let's watch now the video of Vianney Robert, Head of the Development at MovingMed. So hi Vianney, can you present yourself?
Hi, my name is Vianney Roberts and I'm the Head of Development of MovingMed, which is an health tech startup based in Montpellier.
Can you tell us more about MovingMed?
Yes, MovingMed is a startup who was born in 2016, and we support the healthcare professional in order to implement efficient and actionable e-health program. Our conviction is that when you talk about e-health program, it's not about technology, but about human support. You need to help the physician to endorse the project and to use the tool. I will come back on this point later, but I think that the use of an e-health platform is the key of the success.
Can you tell us a little bit more about the enablers? How you made this startup grow, and in the ecosystem, which partner in the ecosystem you used?
Yeah, first of all, we need to say that it's a good opportunity to create a startup in France, because you have the unemployment benefits provided by the government. We can help you for 1 year or 2 years to pay you with your unemployment benefits, and you can create your ID, you can test your ID with a professional, so you have really 1 or 2 years to develop the ID and to confirm the ID to the reality. That's the first point of the French ecosystem. The second stuff is that you will find many actors who are unable to fund you, which are government actors like the BPI, the government bank, the state bank, or private actors, and you can easily find fundings in French dedicated to innovation. Then regarding to Montpellier, Montpellier is a specific ecosystem for medicine, because historically Montpellier is a city of medicine. We have one of the oldest universities in medicine in Europe. So you have a lot of healthcare professionals who are really willing to discover new ways to innovate, especially when it comes to e-health innovation. So it's a very good field to expand your innovation.
Finding a business model is always a challenge part of an e-health company. Can you tell us a little bit the secrets?
Yeah, I think before speaking about the e-health models, you need to focus on the needs. You need to understand really what are the needs, not only of the healthcare professional, but also of the patient. That's easy to say, but not easy to do. Before creating our platforms, we did a lot of patients group and healthcare professionals group in order to understand the needs. So you have a wish list from the healthcare professional and from the patient, and then you try to manage to combine both of them and to create the platforms that will meet these two visions of the ideal. But when you have created this platform, it is not the one who will be used in the real life. You have a gap between the dream, the wish list of the actors, and the functionalities they will really use in the real life. So that's one of the key learning of our experience. So you need to find the good way of developing stuff according to the wish, but not too much, and to test in reality what are the key functionalities they will use, and not to develop and invest on developing only based on the wish list. That's for the understanding the needs of the ecosystem. The second part is about the business model. I will speak about France and Europe specifically because MovingMed is based in France. I think that the business model in e-health is not sustainable today. We don't have any initiative which has a sustainable business model. The B2C is not possible in Europe. I think many patients are not willing to pay for their care. They are willing to pay for a smartwatch, but they are not willing to pay for care. So you cannot make the patients pay for health services. So, which means that the only actor who can pay are the hospital or the payer. We can be a private payer or a public payer. So we need to deal with this actor. Some countries try to pave the way for the reimbursement of some telemedicine fields like teleconsultation or telemonitoring. I think about Spain, Germany, who paved the way for kind of reimbursement. But today we don't find the good balance between the reimbursement and the investment on the other side. That's the first part. Then some startups try to find a business model based on the pharmaceutical industry because they are good payers and they are willing to pay for innovation. But I think in my mind that you cannot have a sustainable development if you only live with 10 or 20 key account pharmaceutical companies. You need to diversify and you need to make pay the payer of your healthcare system. So you need to integrate yourself in the whole healthcare system, which means that you need to demonstrate the value of your e-health platform and to demonstrate on a clinical framework, which means a clinical study. And it's not only proving that you have a medical added value, but also health economic added value, because the payer will be willing to pay only if you prove a health economic value. So, which means a lot of investment that only a pure startup with 10 people cannot do. So you need to have strong investors around you to invest on that clinical study.
What is the future of MovingMed? Where do you see it going?
In MovingMed today we have two platforms. One platform dedicated to the healthcare pathway, who help professionals who work on different places to manage only one patient. It's a e-health record for the patient, and the patient has an application. On the other side, we have a telemonitoring tool in oncology, in health, in mental health, and in cardiovascular disease. This is a specific tool which met the French national week. It is a specific tool which met the demand of the national authorities in terms of cybersecurity and interoperability. It's a brand new platform, launched this year, and our objective today is to mix both of our platforms, to have on the same platform both the telemonitoring tool and the healthcare patient tools, and to provide it to our clients.